Welcome to the Trial Site News Roundup. Today in our episode we'll be discussing Mumbai and their move to use ivermectin as a prophylaxis. This while Uttar Pradesh smashes COVID-19. Then, an unusual turn of events where the Indian Bar Association serves legal notice upon Dr. Soumya Swaminathan, who happens to be the chief scientist of the World Health Organization. We're going to talk about this. And so, from Trial Site News, I'm Adrian, and our episode starts now. So while here in the US, the official guidelines from the FDA and the NIH as of this filming are still as follows, the FDA having cautioned against the use of ivermectin for use against COVID-19, saying that they have not approved ivermectin for use in treating or preventing COVID-19 in humans, and the NIH has a softer stance on the subject of ivermectin, a neutral tone neither for nor against the use of the drug, saying that there is insufficient data to recommend either for or against the use of ivermectin for the treatment of COVID-19, and they say that results from adequately powered, well-designed, and well-conducted clinical trials are needed to provide more specific evidence-based guidance on the role of ivermectin in the treatment of COVID-19. Now, in India, however, ivermectin is now on the National Indian COVID-19 list of recommended treatments for COVID-19, with now a few states having included the low-cost generic drug as a prophylactic targeting SARS-CoV-2, which is, of course, the virus behind COVID-19. 3 Indian states, including Goa, Karnataka, and Uttar Pradesh, have authorized ivermectin as a prophylaxis along with vitamin D during this pandemic. Now, Maharashtra, which is home to about 126 million people, and the city of Mumbai have filed an action with the Mumbai High Court directing the central government to file an affidavit based on public interest litigation, or PIL, that calls for ivermectin and vitamin D as a prophylactic regimen in the COVID-19 protocol. Now, 2 justices, Ahmad Saeed and Girish Kulkarni, sought to elicit the central government's stance on this request. And according to the Times of India article, Dr. S.N. Taida, representing the health services of Mumbai, had a response submitted opposing the PIL, declaring no new advisory is necessary given the state of Maharashtra already has issued a statewide protocol incorporating ivermectin for a course of treatment for COVID-19 patients in combination with home isolation and/or hospitalization, which that particular protocol was enacted back on April 8th of 2021. Now, according to reports, this matter should be resolved by the end of June. In the meantime, an unprecedented turnaround in the nation's most populated state has been supported by an aggressive population-wide scheme using ivermectin-based home medicine kits. Essentially, what appears to be happening with this legal move is an attempt to persuade the national government to add to its national ivermectin protocol use as a prophylaxis as well as a treatment once an individual has been infected with the virus. Now, while these latest developments have been going on, what with Uttar Pradesh, the nation's most populated state, implementing an aggressive population-wide ivermectin regimen, followed by the COVID-19 case count plummeting, this amazing turnaround, however, has been largely ignored by major media networks. Now, it should also be noted that the correlation between the Uttar Pradesh embrace of an ivermectin-based population-wide regimen and the dramatic turnaround in COVID-19 cases cannot be statistically correlated without further study. However, the World Health Organization has recently touted the local action in Uttar Pradesh, including the medicine kits proactively given out, but has hidden the fact that ivermectin is used in them, which seems like a strange omission on their part. And of course, we'll keep you posted on this story as it continues to develop. Now, for the second story of the news roundup, Dr. Soumya Swaminathan, the chief scientist at the World Health Organization, was apparently served a legal notice by the Indian Bar Association, or the IBA, back on May 25th of 2021. This for her alleged act of spreading disinformation and thus misleading the people of India. Now, it has been reported that Dr. Soumya Swaminathan deliberately ignored and suppressed the FLCCC and the BIRD panel's data regarding the effectiveness of the drug ivermectin, with the alleged intent to dissuade the people of India from using ivermectin. Moreover, as we have already reported, the nation of India has now included ivermectin in their national protocol, and in states where the treatment is in wide use, an unprecedented reduction of cases has now been reported. And of course, as I mentioned already, while it is difficult to prove a direct correlation without a design study, the turnaround in cases in Uttar Pradesh is indeed striking. So, essentially what is happening here is that according to the Indian media, the notice is based on the research and clinical trials carried out by the Frontline COVID-19 Critical Care Alliance and the British Ivermectin Recommendation Development Panel, or BIRD, who have presented data that strengthen the case for the recommendation of ivermectin in the prevention and treatment of COVID-19. Now, the Indian Council for Medical Research, or the ICMR, and All India Institute of Medical Sciences, or AIIMS, have refused to accept Dr. Soumya Swaminathan's stance against ivermectin and have retained the recommendation for ivermectin under the may do category, which of course is for patients with mild symptoms and those in home isolation, as stated in the National Guidelines for COVID-19 Management, last updated on May 17th of 2021. And so, in order to stop Dr. Soumya Swaminathan from causing what they perceive as further damage to the lives of citizens in their country, the IBA has decided to initiate legal action against her. And so, with the World Health Organization suppressing data, as we showcased, where they recently issued a report on the significant local effort of the public health operation in Uttar Pradesh, while omitting a fundamental fact that ivermectin is in widespread use as part of the very initiative they reported on their website. So the question now arises, is this recent legal action in India merely a symbolic gesture, or does it represent the harbinger of other such legal actions yet to come? Food for thought. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining us on the program today. From Trial Site News, I'm Adrian, and I will see you all next time.